moving now to an example of a really wonderful project. So I'm going to introduce, in fact, two wonderful projects. First of all, I would like to introduce Jenny King, who is the World at Heart Project Officer. I love that name, at Sheffield and Rotherham Wildlife Trust. Welcome, Jenny. We've had some lovely conversations about what you do. So what I'd like to hear first is, could you just tell me about what your project is? What does it do? Tell me about that.
Yes, thank you, Olivia. So Wild at Heart is a project which is run by Sheffield and Rotherham Wildlife Trust, and we run social groups for adults, and the main aim is exploring local green spaces and to use the natural world to boost well-being. We learn new skills, try out hobbies and make new friends in the communities. And then we sort of facilitate a broad range of nature-based seasonal activities. Yes. And it can include sort of nature in its broadest form. So exploring places in Sheffield and Rotherham, trying out arts and crafts, doing some wild inspired seasonal cooking, trying our hand at sort of micro wildlife gardening, and sort of learning to look after nature. So that might be doing a joint litter pick, that sort of thing. And
a real mix of things, yeah.
Yeah, a real mix of things. And then we adapt the sessions to reflect the changing seasons. And what's most important is that we adapt them to the participants' interests as we get to know each participant. So we use a hobby-based approach, just really to focus on trying new things that help people gain the confidence to perhaps take that on in their time away from the groups, with their own family or to make new friends.
Great. And how long has the project been running? And tell me a bit more about how it's funded.
So we've been running approximately for 8 years, and initially we were funded through the National Lottery Community Fund.
Yeah.
And we're now funded by a range of funders. So we've grown over the years, and this change has taken time. And probably 50% of my work is working with funders, ensuring that we're meeting their outcomes. And what we really need is funders who understand that we need to have like a strategic view and a long-term view rather than short-term funding. So funders that are willing to invest over 5 or 10 years so we can work together on these projects and really meet the needs of people.
That's right. So I suppose growth and
change it's a really interesting discussion to have, yeah.
So in terms of, you said to me when we spoke that a lot of what you do is to do with conversations. And can you just tell me about how the focus of conversations is a bit different in your work from perhaps how it might be in the kind of conversations that you might have in a health setting, for example, if I was seeing someone as a doctor?
Absolutely. So we're commissioned by Rotherham Social Prescribing Service for patients to come along to a session in a park once a week, and we run it all year long. So we have our utter centre of whatever we do is all about having positive conversations. So we're a social group. And we really try and facilitate people to have that positive social experience.
Yes.
That everybody can be included with. So we start, and it's a process that takes time, often longer than a 6-week or a 12-week placement. And we use sort of gentle, natural, getting to know you conversations as we're walking in the park. And that opens up people's interests. We encourage people to share what they might enjoy, perhaps what they might need. So we're not deciding for a person what they need. We're encouraging them to explore that and let us know, and we can signpost people to other organisations or back to the social prescribing team for more direct support.
So starting with kind of pleasure rather than problems, I suppose.
Absolutely.
Yeah, great. That sounds so much nicer than my consultation. So okay. And what other differences might there be in that sort of consult?
So I think what you're saying about pleasure is so important. So we always talk about sort of what do we notice, what sparks joy, what brings moments of play and playfulness. So we might be, exploring with people might say with a child's mind, but with a really open sort of non-judgmental sense of welcoming people to the group and what we're doing on that day, and whether it be a simple walk in the park or something more practical based. So it's a different way of doing sort of health conversations. So it's rather than telling somebody, oh, you know, lose weight by eating a balanced diet or stop smoking, we might introduce those ideas and without labouring the point, so people feel included. And so something like when we're doing wild cooking or seasonal cooking, we might share in the preparation of the meal. We might take turns in cooking and building skills. And a lot of people say, oh, I don't want to do that, I can't do that. But with a bit of encouragement and positivity and sort of modelling that good social behaviour, people do feel much more up for joining in. And then they tell us later how, you know, they've remade that soup at home or branched out to other recipes.
So they've enjoyed cooking together. It's been less about the kind of telling people what to do and more actually doing that healthy cooking together as a group, and you seeing transfer into people's own lives, which is, sounds like an amazing achievement. Thank you so much, Jenny. That's really wonderful. It's really helpful to have a taste of a project on the ground working with people and what difference that makes.